anyone on the panel to respond to anything you've heard tonight, and then at the same time open up the microphone to the audience. If anyone has questions or comments they'd like to share with the panel or any particular point they'd like to hear a panelist address, I invite you to come to the microphone. While you're busy formulating the question, I'll turn it back to the panel to ask if anyone has any particular follow-up. Looks like Andy does. Do you want to go ahead?
First of all, as the youngin on the panel, I'd just like to say that, some of you might know me as, I play bass in a band, and, usually I'm running around teetering on heels, and that doesn't seem to intimidate me. But tonight I'm actually intimidated and kind of nervous, because, I'm here on stage with, these incredible people, and, Arlene and all these incredible people who I know who are, heroes of mine, or, in the audience and on stage with me. So, I'm kind of scared. So I just wanted to say that. So thank you all, everybody, and I'm just so honored to be here. So, point one. Point two, I want to talk for a second about specifically how the health insurance exchange situation is shaping up in DC. And I'll try to be really quick about this. So, from what I understand, and I'm not a lawyer, I'm just a random activist and social work student. But so the health insurance exchanges are being set up, and Kellen, you can fight me on this one or correct me if I get any of these details wrong. But so the exchanges are picking these things called benchmark plans, which are sort of plans that are, I guess, sort of the lowest common denominator of what the other plans can contain, right? And the exclusions in the benchmark plan would be extended to the other plans, right? Am I right on that?
Yes, and actually just to back up a little bit, because the exchanges are one of the major reasons why health reform has become such a big deal, both in terms of the flashpoint controversial issue that a lot of political types have made it out to be, and actually important as far as connecting all of us with the coverage and the care that we need. So the health insurance exchanges are new. 2 states had them before the health reform law was passed, Massachusetts and, Andy, do you know? It's totally random. Utah. So, exchanges, they were bipartisan, but everybody flew out about that. So
Debbie thinks Washington State.
Sorry?
Debbie thinks Washington State also, in terms of has exchanges, Washington State.
Yeah, now there are putting together, various states are putting together exchanges. When the law was passed, only those 2 had sort of tried the model of putting health insurance plans in a marketplace that was online, where you could go and you could compare apples to apples, as the saying goes, oranges to oranges, kind of like Travelocity. Any of those websites that you can use to compare airfares or whatever. And under the health reform law, every single state has to have an exchange. It will be open in every state starting in January of 2014. So we have a little bit over a year to go. Most states have the opportunity to run their own exchanges. Most states are choosing to run their own exchanges. But if a state does not choose to run its own exchange, the Department of Health and Human Services will do it for them. So the federal government will be taking for Texas. Sorry. And one way or another, there will be an exchange operating in every state. The reason that the exchanges are so important from, I would say, the perspective of myself as a trans person, from a lot of the community members and friends that I know, is because the coverage that will be available through the exchanges is subsidized. For people making between about $15,000 and $44,000 a year, you will receive tax subsidies that will make the coverage that you're purchasing through the exchange affordable. So that's a major new way that we will be able to afford actual health insurance coverage that is supposed to be living up to certain standards, and Andy touched on this, and I'll turn it back to her in a minute, up to certain standards of comprehensiveness. The other major reason that the exchanges are so important is because they're creating this whole new idea of what does it mean to have coverage that's actually coverage that you can count on. Because in this country now, about 75% of people who go bankrupt because of medical expenses were insured at the time that they became sick. And as many of us know, having coverage doesn't always translate. Usually doesn't, actually, for us as trans people, usually doesn't translate into the kind of care that we need. So as these exchanges are being put together, every single state and DC has to choose a benchmark plan, has to choose an existing insurance product in that state's market that is going to be the standard against which all other plans are judged. And this is really the first opportunity that we've had to really get a hold of the health insurance industry to say the exclusions that you're carving out, the things that you're not covering, the tricks that you're playing with the benefits are not okay. You have to make a certain level of care available, you have to make a certain level of coverage available, and we would argue you have to get rid of those exclusions because it is complete and utter idiocy to say that you have an essential benefit standard, to say that you have a set of benefits that everybody needs or might need at some point in their lives, and to juxtapose that, put that right up next to a trans exclusion that says, oh, you need a pap test? Sorry, you're trans. Oh, you have a broken bone? Sorry, we're trans. So DC has really done a lot as far as stepping up to the plate and establishing what those minimum standards of coverage should look like. So I will turn it back, and I apologize, I had to go like all health wrong because this gets me all excited. But DC really is doing some great stuff.
Okay, so this is the difference between someone who studies and does this stuff all day and someone who's a dilettante. So just to keep that in mind. So
I'm just background. I'm just the backup singer here.
It's hardly. So you're the rhythm section. It's all the rhythm section. So the problem with DC is that the people setting up the exchange have picked a benchmark plan. It's like the Blue Cross Blue Shield, Care First, Blue Choice, I think is the plan. Lots of blues, lots of choices. And this plan has a transgender exclusion. So the plan that's been chosen as the benchmark plan thus far has a trans exclusion. So we need to organize against that. I didn't write it, but a very smart person wrote a letter that's is addressed to the exchange people to tell them this is bad and explains a series of reasons why it's bad and also probably illegal. So I just, because I don't know, I guess I'm an activist, I made a sign-in sheet. So if somebody wants to sign this letter or learn more about it, I would like to take your information at the end of this thing. So come talk to me if you want to protest the exclusions that have been added to the benchmark plan. Yeah. Oh, yeah.